Hello everyone. Today we will learn cardiopulmonary resuscitation, CPR, techniques. As is well known, when life-threatening emergencies or accidental injuries occur, whether immediate on-site rescue can be provided is directly related to the elderly person's survival. The chain of survival was introduced in 1992 as a specialized emergency term internationally. It refers to the sequence starting from the first on-site witness until professional rescuers arrive. It is a chain composed of a series of rescue actions. The 5 continuous links include: the first link is to immediately recognize cardiac arrest and activate the emergency medical system. This includes early recognition of the elderly person's symptoms and calling the emergency medical services. The second link is to perform CPR as early as possible, focusing on chest compressions. This refers to CPR performed before professional rescuers arrive. It can be performed by both professionals and laypersons. This is also the simplest and most effective rescue measure. The third link is rapid defibrillation. Early electrical defibrillation is a key factor in promoting survival. The fourth link is effective advanced life support, referring to early use of medications or devices to provide advanced life support. The fifth link is comprehensive post-cardiac arrest treatment. As many organs are damaged after cardiac arrest, comprehensive treatment after resuscitation remains crucial. As frontline caregivers, we must focus on mastering the second link, that is, cardiopulmonary resuscitation techniques. After learning basic CPR, in case of an accident, we can immediately make correct judgments and take appropriate actions. This buys valuable time for further rescue efforts and ultimately saves the elderly person's life. 1. Assessment. Assess the environment. It should be clean, free of odors, with suitable temperature and humidity, and away from fire sources and other hazards. Assess the patient's condition and level of consciousness, focusing on breathing and pulse. Determine the patient's care needs. Upon assessment, if the patient has no heartbeat or breathing, has lost consciousness or is unresponsive, immediate rescue is required. 3. Plan. Immediately perform cardiopulmonary resuscitation on the patient to conduct emergency rescue. Four. Implementation. First, upon finding a collapsed patient, gently pat the patient's cheeks or shoulders with both hands and shout loudly near their ear to assess their level of consciousness. If there is no response, continue to check for major arterial pulse. Sites for pulse check. 1. Carotid artery. Use the tips of the index and middle fingers to touch the midline of the trachea. Or, in males, first locate the Adam's apple, then slide to the lateral side of the neck into the groove between the trachea and muscle groups to feel for carotid pulse. 2. Femoral artery. Palpate the arterial pulse below the inguinal ligament. Assessment time is about 5 to 10 seconds, no less than 8 seconds. After confirming the patient is unconscious and has no pulse, immediately ask others for help. Call 120 or alert medical staff, and simultaneously begin CPR. Position the patient. Lay the patient supine on a flat surface or hardboard bed. Remove the pillow, tilt the head back, and loosen clothing. Begin with chest compressions. The rescuer stands or kneels beside the patient. Compression site, lower half of the sternum at the middle lower 1/3 junction, at the intersection of the sternal midline and the line connecting the two nipples. Method: lace the heel of one hand on the compression site. Place the other hand on top, aligning the thumbs, with fingers interlaced or lifted, To avoid contact with the chest wall, keep elbows straight and shoulders directly above the hands. Use the rescuer's body weight and arm strength to apply rhythmic vertical pressure on the patient. Compression depth. Each compression should depress the sternum at least 5 centimeters. Then quickly release, allowing the sternum to return to its natural position. Repeat this process. Compression rate, at least 100 compressions per minute. The ratio of compression to relaxation time is about 1:2. During relaxation, the heel of the hand should not leave the chest wall. Next, open the airway. Turn the patient's head to one side. Clear oral secretions and foreign objects. 2 methods can be used to open the airway. 1. Head tilt chin lift. The rescuer places the hypothenar eminence of one hand on the patient's forehead to tilt the head back, and places the index and middle fingers of the other hand under the patient's lower jaw, lifting the jaw upward. 2. Jaw thrust maneuver. The rescuer places both elbows on either side of the patient's head and places the index, middle, and ring fingers behind the angles of the jaw, lifting the jaw upward or backward. This method is suitable for patients with suspected neck injury. The third step is artificial ventilation. The preferred method is mouth-to-mouth resuscitation. Specific steps. Place a gauze or barrier mask over the patient's mouth and nose. Maintain head tilt position. Use thumb and index finger to pinch the patient's nostrils. The rescuer takes a deep breath, holds breath, and completely covers the patient's mouth with their lips. Forcefully blows air, causing the patient's chest to rise. After ventilation, immediately release the nostrils. The rescuer lifts their head slightly, turns to the side to inhale while observing the patient's chest fall. Ventilation rate, 1 breath every 6 to 8 seconds. Approximately 8 to 10 breaths per minute. The compression to ventilation ratio is 30:2. Throughout the procedure, continuously observe the patient's condition. 5. Evaluation. After completing 5 cycles of chest compressions and ventilations, assess the effectiveness of resuscitation. Signs of effective resuscitation include 1. Palpable major arterial pulse, or blood pressure above 60 millimeters of mercury. 2. Lips, face, and nail beds turn from cyanotic to pink. 3. Pupils return to normal size from dilated. 4. Breathing gradually resumes. 5. Consciousness improves with return of reflexes or spontaneous movement, or after CPR. Successful handover to professional emergency personnel for further treatment. Precautions for CPR. 1. Before starting rescue, assess consciousness and pulse and confirm absence of pulse before initiating chest compressions. 2. Compression site must be accurate. Apply appropriate force. Keep both arms straight, elbows locked, shoulders directly above the hands. After each compression, ensure full chest recoil before the next compression. 3. During artificial ventilation, ensure the airway is open. Completely seal the elderly person's mouth with no air leakage. Each breath should produce visible chest rise, otherwise, ventilation may fail. That concludes our lesson on cardiopulmonary resuscitation. We hope you will study seriously and practice well.